in Baltimore and WNST.net. All of our WNST coverage here, of course, brought to you by our partners at the LifeBridge Health Sports Medicine Institute, Foundry Row in Owings Mills, where, I wonder, why do they want to be involved with a 50-year-old washed-up kind of athlete, sports guy like me? It's because I keep breaking down. Dr. Craig Bennett is here. He is with all things orthopedics there, which when you get to be my age and you get a little creaky here and again. And, Doc, first off, welcome. Happy spring to you. Hopefully the hay fevers and the allergies aren't getting to you like they are to the rest of us.
Happy spring. I've got a little bit of it. This is the time of year, but all is good, though.
Well, you hooked me up about 6 months ago with this arm brace that I'm showing out on our Facebook Live and our YouTube. And I had, I think you said the fancy way of saying tennis elbow or something along those lines. And I think part of this is sort of like you wear it for a month and you think, oh, it's fixed. It feels okay. About 2 weeks ago, I picked up a pot, felt it again, it was coming back, and I've started to wear it again, and it goes away. It really is amazing how we think like sort of medicine or some sort of technique that is sort of a cure-all. Sometimes it might be a little bit more of a life sentence than maybe I realize.
Yeah, so you have tennis elbow or lateral epicondylitis. The epicondyle is the outside part of the elbow, and it's the origin of the tendons that move your wrist around. So your wrist and your fingers. So if you had said, I have this problem because I did X at one point in time, then doing some therapy for a little while and using your brace for a short period of time might take care of it. But yours was a gradual thing. It's a wear and tear, so you're going to have to continually work on it. So to your point, when you have degenerative problems that come about slowly, then it takes a long time to get them better, and sometimes there's some permanence to the therapy and the exercises.
Whoa. You just used the word there I don't like, degenerative. That means, like, getting worse.
Down. Worn down.
Man.
You have some worn-out parts.
And that's what's worried me. So I didn't even want to tell you this, right? Because you're my doctor, and I came out, and my wife has used you for various things with her frozen shoulder and whatnot. Last couple of weeks, I've been having a little left hip pointer issue, and part of it is for me, like with yoga, and it's about balance in my spine and subluxation. That if I wear good tennis shoes, and thank you, Josh Levinson over at Charm City Run, that when I can walk miles and miles pain-free. But if I sleep on my stomach, flat. I don't even use a pillow anymore. I'm like a flat yoga sleeper now. But when I sleep on my stomach, I'm either sleeping to my left or my right with my ear, and it's really affected my hip. And I'm afraid I'm going to have to come see you at some point about my hip. I was a catcher. I played tennis. I moved around a lot as a kid. I have friends that have had replacement hip or hip replacement, whatever you guys call it. I'm a little nervous. It's like going to a prostate exam or something. So one of those things, do I call Dr. Bennett and say that I have a hip issue, or do I not even want to know what's going on with my body right now?
No, you know the answer already. You want to know.
That's why I'm telling you right now.
Yeah, and when people talk about their hip, a lot of times, and you're talking about this now as well, people are really talking about areas of their pelvis. And so there's a big difference between having trouble in the joint. So the hip joint is really towards the area where we think of the groin, and it's in the front. And so having a hip joint problem is vastly different than having something in the pelvis area, and whether that is your tendons or bone or muscle, you want to know what it is so you can treat it appropriately.
So in other words, instead of telling you about it on the radio, I probably should get out to Foundry Row and see you here soon.
Yeah,
call Lori. Yeah, I mean, I don't know at what point you call the doc, right? Like, I admitted to you, and I admitted it on the radio and in your office back in whenever it was, maybe October, November, that I came to see you, and I said, this has been going on since August, and you feel it the first day, the first couple of days, and, you tell your wife, and your wife's like, go to the doctor. And you're like, nah, it's just a little mole, or it's just a little thing, or it's just a little tweak. I don't know at what point I have to wake up every morning and get upright and settle, because it does go away, right? Like, when I stand up and I get my pelvis moving the right way and I get my sneakers on, by the time I go to yoga at noon, I'm good. And part of it is, quite frankly, sitting. One of the things I'd love to talk to you about, and I think my wife would too, is we see these sort of Varidesk things, and our friends at Price Modern have them where you stand to work. So maybe I could do everybody knows I sit when I do radio and video, because I've done it that way Since I started doing radio in 1991, I sit because that's the way I was trained. It might not be the better way to do it. I see the new television sports talk shows, the guys stand at a podium or wherever they want, or they move around, like the ESPN anchors. I'm thinking to myself, maybe I should be standing, and this might be better on my hip than sitting here, because what do they say? Sitting's the new cancer? Somebody said that. You're a doctor. You're not going to say that, but sort of a catchphrase that sitting's probably not all that great for my hip either, right?
Yeah, well, you've touched on some big things. So your first question was, when do you call the doctor? When do you come in? You're 50. You don't want to call somebody and come in for everything. But if you have something that is persistent and it goes on for 6 weeks and is not improving, then you need to think about having that evaluated. Every ache and pain is not something you're going to come in for, but if you've got something just will not go away and you've taken the appropriate steps, like you've described, the standing, yes, you already know some of this. You want to vary things up. You don't want the same joints, the same tendons, the same tissues stressed day after day, day after day. You want to vary things up, and standing and being ergonomically correct is something you should definitely do.
Go ahead. I'm sorry. I love here. This is one of the great parts of having you on, is just sort of get this sort of practical sort of, the advice you give me if I came out to see you, if I don't need a surgery or a shot, right? Like if I need a brace. These are very sort of rudimentary things that everybody's sleeping 8 or 10 hours a night, and sometimes we do it wrong. Just in general, our body's weird, and we wake up with these aches and pains that come from sleeping wrong, right?
Correct.
Wow.
So there's a lot of little things. And going back to your initial question as well, if you said that you have swelling, there's a difference between pain and discomfort. Pain, swelling, and decreased range of motion. Those are things that if they are persistent, particularly if they're lasting in the 6 to 7 week period of time, those are things that you would probably want to consider going into seeing your doctor for.
Dr. Craig Bennett's always giving me good advice as well as a good brace. Everybody needs a friend they can turn to. I got one out of LifeBridge Health Sports Medicine Institute, Foundry Row in Owings Mills, along with Dr. Kevin Crutchfield, who does concussion and head-related injuries. We get together here every week and try to talk some common sense and things into all of this. And I guess we're into lacrosse and baseball and all of those things that test joints here this time of the year. I'm sure in the spring season you're seeing this amongst athletes as well as weekend warriors. The weather gets good, and we all want to go out and hit the golf ball, right? Especially after we see Tiger Woods do it so deftly, right?
Absolutely. And the recommendation is if you have not done an activity for a long period of time, then gradually get into that activity and stretch appropriately both before and after.
So what you're saying is when Tiger was coming down the back nine 2 weeks ago, my wife's like, hey, you got golf friends at Compass Point. Maybe you should go over there and hit a bucket of balls. I'm thinking maybe we should get a small bucket and stretch a lot before we go, right?
Absolutely.
Doc, appreciate you. Thanks for fixing us up and keeping us straight. We'll get back in touch in a couple weeks.
Okay, great talking with you.
Dr. Craig Bennett, LifeBridge Health Sports Medicine Institute in Foundry Row, taking questions from people like me and turning it into radio and making me smarter and getting me thinking more about my hip, more about my... Last thing I want is like a hip replacement, right? Last thing I want is elbow joint surgery. The last thing I want is another one of those needles that comes out and it's cortisone and all that stuff. Part of the reason I do yoga, part of the reason I'm eating berries, part of the reason I'm doing Baltimore Positive and staying healthy, and my wife's running a half marathon. We have great partners. LifeBridge Health Sports Medicine Institute found you around wearing the shirt. Sometimes I wear the hat. Lori, I need a mug. Let everybody know that. Neil Meltzer, I need a mug. Tell everybody. Brian, everybody. Nasty at WNST.net finds me. I'm on Facebook and Twitter and LinkedIn and Snapchat and Instagram and anywhere the internet travels in the buyatoyota.com audio vault 24 hours a day. Little education, little Baltimore Positive, some Orioles, some Ravens, and getting you ready for the Preakness as the folks appear to be trying to move the race for the 30th year in a row. So we'll continue to talk about all that as Bob Baffert comes to town as well. I am Nestor. We are WNST.net, AM 1570, and WNST Towson, Baltimore, and we never stop talking. Baltimore Positive, Baltimore Sports, in conjunction with our friends at LifeBridge Health Sports Medicine Institute in Foundry Row.